Good morning, everyone. Thanks for joining. We are going to get started here in a minute or two. We're going to see who else is going to join over the next minute or two, and then we will get the meeting started. All right, let's get started. Welcome, everyone, to today's monthly webinar hosted by the National Hospital Association Strategic Partner Coalition. My name is Matthew Bobo, and I'm a vice president with Affiliated Enterprise Solutions. AES is a national healthcare association consulting firm with regional, state, and national association clients from across the country. In collaboration with the 5 regional and metro hospital associations represented today, AES has developed a national strategic partner coalition focused on delivering best-in-class healthcare solutions to hospital members. We're glad that you could join us and are excited to share our new best-in-class solution designed to support hospital members nationwide. A couple of housekeeping items. If you have questions during the presentation, please post them in the Q&A section of Teams. I'll be monitoring questions throughout the webinar and we'll address as many as we can before time runs out. Also, this session is being recorded and the recording will be shared with your association after today's webinar for distribution. With that being said, we're excited to introduce GroupOne Background Screening as a new strategic partner. And it is my pleasure to turn things over to Delinda Bailey, president of GroupOne, who will introduce the organization and begin today's presentation. Delinda?
Thank you, Matthew. We are excited today to introduce GroupOne Services. It's a background screening company heavily concentrating in healthcare. However, we do perform background screening for other industries. And once we get into the webinar, our sales associate, David Graves, will be really explaining and showing all that we have to offer. During the webinar, so let me introduce David Graves first. David Graves is our sales manager, as I mentioned. He has spent about 8 years with us here at GroupOne. He has helped organizations work through the hiring process, making us smarter, effective solutions tailored to each organization. And then before moving into sales here at GroupOne, David actually gained a lot of knowledge and background screening through his work as a human resource employee. He worked at groups like Parkland Health and Hospital Services here in Dallas, Texas. He has a unique perspective on practical solutions, compliance, other areas of human resources needed to make sure you get a good hire. And I know each of you encounters similar situations daily. He has developed strategies, building specific packages to meet needs of our various customer types, helping again to ensure that you all get the best hiring solution out there. So I am excited to introduce David Graves and let him share his insights and experiences with you today. And we are here to answer any questions you may have and also any comments or suggestions. So David, I'll turn it over to you.
All right. Thank you so much, Delinda. Thank you, Matthew. And appreciate the opportunity today to talk about Group 1 background screening. And so let me share my screen with you here. Get things kind of kicked off. And I want to sincerely appreciate and say thank you to National Hospital Association Strategic Partner Coalition for the opportunity today to speak to you and talk to you about Group 1 background screening. I hope that today's presentation will be informative, educational, and helpful to you as an organization. And so I want to move on here to let me make sure I can move my slides here along today. There we go. All right. So without further ado, we'll just kind of dive in here and get going. I want to talk to you a little bit about who Group 1 background screening is. We're a healthcare partner in safety and compliance, and we really work hard to build trust by keeping healthcare workplaces safe. And so I want to talk to you about how Group 1 background screening was formed. It started back in about 1988, where a group of hospital CEOs got together and they had a vision based on them being burned probably by some employees that went from one hospital to another hospital, bad apples, if you will, that went from one hospital to the other, and the hospital CEOs put their minds together and they came up with a vision, which was to protect patient safety in hospitals by making sure that one bad employee didn't get from one place to the other and get hired on at that other hospital. And so that vision that they started long ago became what is now today known as Group 1 background screening. It was created by that hospital council at that time, which is also the Dallas-Fort Worth Hospital Council, which owns and operates Group 1 background screening. Group 1 is a CRA, and if you don't know what a CRA is a consumer reporting agency, and as such, we operate under the guidelines of the Fair Credit Reporting Act, or FCRA. And I wanted to take just a pause right here for a moment, just for our legal department, to say that any information that is shared today is shared as best practice information and should not be construed as legal advice or legal counsel. None of us here at Group 1 are attorneys at law. So everything that we share today is really to be considered as best practices when it comes to putting together your background screening process. I'll talk a lot about this today, but our mission and our value at Group 1 always focuses on accuracy, compliance, and patient protection. It always comes really down to making sure and ensuring that at your hospitals that all of your patients' families, and the workforce employees are always safe when they're working inside of your hospital. And we do that by providing the best background screening so that you can vet employees day one before they arrive inside of your workplaces. Group 1 was built by hospitals for hospitals. And so what I mean by that is that we are a hospital-centered foundation. Some of the things that you'll learn about Group 1 is that we were established by hospitals, which means that we have a good understanding of how hospitals operate and how they need to be compliant. One of the things that you'll also learn about Group 1 is that each and every employee that works at Group 1 is a licensed private investigator licensed by the state of Texas. And another interesting fact is that many of the employees that work for Group 1 now have had experience working also on the other side of the counter in hospital settings. So we know what it's like to be inside of your shoes as far as having a deeper understanding of what it is inside of a healthcare. We know the stresses, we know the challenges that you face. And believe me, we're learning more and more about those challenges every day. And part of that understanding of what your challenges are is to understand your compliance and your standards that are necessary for working inside of your hospital, for you to be compliant with such things as the Joint Commission or the CMS, Centers for Medicare or Medicaid, and making sure that all of the information that we supply to you is always compliant with those standards. Another thing that we really strive to do at Group One is to make sure that we tailor our background screening solutions to your needs. We realize that when it comes to background screening, not one size always fits all. There really are different needs inside the hospital. You have various different positions throughout the hospital, all the way from dietary aid to linens, all the way to the doctors, the nurses, the anesthesiologists, the medical technicians. All of those working inside your hospital all have different needs when it comes to vetting them for employment inside your company. And so we really work hard to improve your hospital incomes. Job number one, goal number one, really for Group One is to make sure that we reduce your turnover inside your hospital. We want to also make sure that we're mitigating any liability and strengthening your workforce and the trust of the patients and the people that are your clients over time. Evolution while staying true to vision. So as you can imagine, over the years, Group One has morphed and evolved into what it is today. From 1988 to the current, we have strived to keep abreast of all of the various changes that happen in healthcare, all the way from going through COVID back in 2020 to the current time. Group One has stayed abreast of all of those changes, but we've also really strived hard to invest in technology so that we're always ahead of the curve when it comes to technology. For example, we integrate with almost every ATS system that's out there. If you're in human resources, you know that an ATS is an applicant tracking system. Some of the popular ones out there that come to mind are iCIMS, Workday, and there are many, many others out there. We can integrate with just about each of those technologies and those ATS systems out there. And even if there is not pre-built software in place for us to be integrated with it, we have what's called an open API, which means that anyone can build to our software platform. We've also worked hard over the years to build strategic partnerships like the one that we're developing now today with Strategic Partner Coalition. But Group One also operates heavily in the states of Oklahoma, Texas, Arkansas. We are partnered with Oklahoma Hospital Association, the OHA, as well as Texas Hospital Association, the THA. And so we strive to keep those partnerships and grow with other partners just like yourself. All right, now I want to take a pause here. Take a drink, pardon me for that. I want to talk about the role of background screening in the healthcare industry. And so job number one, really for Group One, is to make sure that your hospital is the safest place in the world for your patients to go and receive care. And the way that we are able to help in that part is to provide the most safe background screening that we can. Background screening safeguards vulnerable patients by ensuring that all healthcare workers will meet that high safety and integrity standard of level. And I want to talk about what's called risk of negligent hiring. Negligent hiring is when you hire somebody knowingly or unknowingly, hiring somebody that has a criminal background in their past. And there is a famous case, I don't have a slide for it, but the gentleman's name is Dr. Michael Swango. You can look this up online and there's lots of videos out there, but he's a convicted serial killer who was a doctor who performed services at hospitals. He came out of Ohio State University, practiced medicine in Ohio, Illinois, New York. But after he got out of his internship, he became a doctor, and suddenly after that, patients suddenly started dying. And he would overdose those patients with whatever medications they were prescribed. He would just overdose the medications. And so people mysteriously started to die. Finally, it caught up with him. He was convicted and put in prison for a time. He got out. And then based on the word of somebody else who knew him once he got out, he was able to land a job without the hospital running a background check on Dr. Swango. And so Dr. Swango was able to slip through. Of course, once he got hired on at the next hospital, more patients suddenly started to die. And also his coworkers began to die as he would slip rat poison or arsenic into their food in the break room. So you can imagine they came in for a happy day on Friday when they brought in donuts, or as the story goes, I guess he also put arsenic in their fried chicken at one point. And so then the people started, coworkers started passing away. So anyway, they finally caught him, convicted him. He got out again, but then this time he went out of the country, practiced medicine in Zimbabwe, Africa. Eventually people started dying there as well. And then the FBI extradited him back to the United States, where he now faces a life term. I think it now says he's 71 years old and he is in a prison, AFIX Florence, I guess. I think that's in New York. So fortunately, he's been put away. The unfortunate part was that the hospitals that could have run a very thorough background check on the Dr. Michael Swango did not. And so all of this was preventable had they run a thorough background check. Obviously, that's probably a very rare case, fortunately, and it doesn't happen all the time, but it could. And so that's why it's very important to make sure that we're always protecting patient safety by having the most thorough and accurate background checks, and making sure that we always run a background check, because we don't want to be negligent of forgetting to run one or not running one at all. At GroupOne, we run comprehensive screening solutions, meaning that we don't just trust one source. When we run a background check, we use multiple sources so that we're always using a multi-layered approach when we're running background checks. What I mean by that is whenever we run a background check, for example, we will run all of the counties that that person lived in and maybe worked in over a period of time, maybe 7 or 10 years. But then we don't really stop there, because what if that person committed a crime outside of where they lived? We also want to make sure that we're doing our due diligence to check their background for records that maybe were in states or counties outside of where they live. So we'll run a multi-jurisdictional search. We'll also run other searches like all available state databases, all sex offender registries, as well as all Indian tribal nation territories as well. But the point is that when we run a background check, we don't want to rely just on one single source, but we want to use a multi-layered source so that we're always providing you with a comprehensive, all-inclusive background screening solution. All the while, we always want to be and stay committed to patient-centered care and safety, which really makes you a trusted partner in your communities with your hospital patients and families. And now as I go in to talk about, I want to talk about, really there's two different types of background checks when it comes to background screening. There's pre-employment screening and there's post-employment screening. And the first one is, of course, the one that everybody runs when somebody comes in the door the first time. But later, I want to also talk about the importance of post-employment, which is running background checks on people after they've come in your door. Maybe they've worked there 5, 10, 20 years inside your organization, but how do you work and strive to making sure that they also don't have criminal records after they start working for you? So let's talk about the importance of pre-employment screening. And really what a background check is, it's really more than an assessment of the applicant. It's really more than a filtering tool. It's an assessment of who that applicant is, who that candidate is and what is their relevant job potential when they start working for your organization. And of course, inside of a hospital environment, inside your culture, you want to maintain and make sure that it's the safest place for that patient to go and their families to go. Pre-employment screening plays a crucial role in protecting companies from dishonest employees or dangerous employees, and it ensures that the hospital and all of their patients are safe. And we do that, as I mentioned a while ago, by making sure that we're always providing accurate and reliable information that you can trust. Our goal, number one, is to simplify the process with the quality information that helps you detect risk factors and allows you to spend more time identifying quality workers for your hospital. These are some of the services that we offer at GroupOne. As I mentioned before, we really have a multi-layered, multifaceted approach when it comes to background screening. So everything really builds from a Social Security trace or Social Security number validation. And so what I mean by that is we take that Social Security number of the candidate from the very beginning, and based on the information that we have attached to that Social Security number, our address history, and we're able to use the credit headers associated with that credit or that Social Security number and identify where that person has lived, worked, or applied for credit over a period of time, say 7 years or 10 years. And we take that information and we're able to compile all of the counties where that person has lived. We also know what state or states they've lived in. And then we're able to search those different places to determine what crimes could have potentially been committed by that person inside of those places. We'll also check all federal records. We have different searches that we can use for federal searches, such as statewide or local, but we can also check that on a nationwide level as well. And then, as I mentioned before, we don't just stop at the places where that person has lived. We also use what's called a multi-jurisdictional search, which searches over 1,500 plus odd search sources to see and identify if a potential crime may have been committed by the person with that Social Security number and their date of birth. And that's where our researchers here at GroupOne come into play. By the way, all of that is done in our offices in Irving, Texas. We do not outsource that care, but we have or outsource those roles or those jobs. We employ our researchers in-house here at our offices in Irving, Texas, where, as I mentioned before, all of them are licensed investigators through the state of Texas. And that's where they do their due diligence, which is researching those records to make sure that the person that's on the other side of the counter that you may be hiring into your hospital, that if there is a record that potentially has come up, we want to clarify and make sure that it is indeed that person's record before we report it back to you. I also want to talk about, those are all the criminal elements. Very important, obviously, to make sure that if somebody's working in your hospital, they haven't robbed a bank or murdered somebody in their past or something worse. However, there are other things to background screening, such as employment, education, and professional license verification. Many times when it comes to a background screen, you want to know, where did that person work? How long did they work there? And really, did they work there at all? You also want to know, did they get their education degree from the college or university that they said that they did? And do they have a professional license or certification to work in the position that they're supposed to work in? There's been studies done in the past through some of the job hiring websites where they would ask, how many people lie on a resume? And most of the studies and the surveys came back with people admittedly saying that 70% either lied or exaggerated information on their resume. That being the case, that makes it very important for you to know, did the person really work where they said they worked on their resume? And did they work in the role that they said they worked? Did they really graduate from a college, or did they just attend a few classes at that college? And do they really have a nursing degree or nursing certification that makes them eligible to work with your patients inside your hospital? So for obvious reasons, it's very important for you to know, especially in those type of positions, uh, have you checked their employment, education, or professional license? Other things that we check and can check are motor vehicle driving records, which is very important, especially if you have people driving for you in your senior facilities or at your hospital. Maybe they're driving people to and from locations within your hospital. But if you have drivers, it's very important for you to know, do they have DWIs? Have they run a lot of stop signs and stoplights, making them a danger to the people that they're transporting on your behalf? We can also check federal, state sanction and exclusion checks. Very important in hospitals, especially when you need to know if your hospital is eligible and qualifies for Medicare and Medicaid. If they have committed some type of fraud at another hospital, have you checked the sanction and exclusions to make sure that they're eligible to work inside of your hospital now? We also offer international background screening as well, which means that nowadays, with a lot of people hiring people from overseas and other countries, have you checked their education, their employment, or do they have a criminal record outside of our country, in another country that would put your patients and your hospitals in harm's way? I already mentioned a little bit about the ATS integration earlier before, but we do integrate with pretty much all of the ATS systems out there. We also perform drug screenings, and we work with a partnership with a company called i3 Screen. And by partnering with i3 Screen, it gives us a network in which we can partner also with LabCorp and Quest Labs throughout the United States, so that people can take their drug test if they're needing to drug test. Maybe they're coming to your hospital that's in New York City, but the person lives in Dallas, Texas. We're able to provide a drug screen for them in Dallas or throughout the country and to determine whether or not they're going to work and pass that drug test before they begin to work for you in your location. Some of the other things that we check is employment credit checks. They're a little bit different than the credit checks that your mortgage loan officer uses to check credit there, where they're looking for a FICO score or whatnot. These credit checks don't really give a score, but they do show such public records like bankruptcy and how a person handles their finances. This is important to know if you're hiring somebody in a executive position inside your hospital, a CFO or a CEO, or someone in your accounting department who's handling your finances, just to make sure that if they can't handle their own finances, they probably can't handle your finances, right? We also have automated an I-9 solution for you. So in human resources, when you're filling out those I-9 eligibility to work in the United States forms, we've automated that whole entire process so that you can work with your candidates to have all of that information filled out even before they arrive the day of orientation. And if you allow us to become a proxy on your behalf, we can handle the whole E-Verify process through the government everify.gov site and handle that whole process and make that automated for you as well. So that's some of the products and services that we offer here at GroupOne. The next part is the second kind of background check that I mentioned earlier, and that's post-employment screening, which I would
David,
argue is probably as important, if not much more important, to run these background checks, because you may get somebody come through the door on day one for your company, but how do you know that they haven't been stealing from other places or other people, that they don't have a DWI, that's on their record now. The only way you're going to know that is if you are running background checks after they have begun working for you through post-employment.
Hey, David, real quick before you go on, I just had a question around you listed out the various screening types that you have and screening services that you provide. What's the typical turnaround time for those background checks, and if there's any delays, how do you typically handle those?
Yeah, that's a very good question. So turnaround times, they do vary by what type of background check that you're running. So if you're running a criminal only type of background check, typically those would probably turn around in 1 to 3 days on average. There's always going to be outliers in many of those cases, because if you have somebody, for example, if they have a very common name such as John Smith or Betty White, something like that, that's a very common name. That's where our researchers do their due diligence. It may trigger a red flag for that particular common name, but we're going to do our due diligence to match that name with that person's social security number and their date of birth as identifiers to verify if that person is indeed your person. So, and that does take some time. So, on average, it might take 1 to 3 days. It could take maybe a little bit longer just to verify that we're giving you the most accurate information. There's also other things that are outside of our control and many times, such as weather conditions, hurricanes. I think it's hurricane season. Is that coming up here soon? Sometimes that can cause delays across the country. There's been a lot of cyber attacks out there, as you probably see on the news and things like that, where county courthouse systems have been taken down for several days or weeks and caused delays in obtaining information. So that's a very long answer for that. But also turnaround times can be challenged if you're also adding in employment, education, or professional license type items. I used to be in human resources. I was an HR generalist for 20 years. And until I worked at GroupOne, I didn't realize the importance sometimes of returning those phone calls back to employers who were trying to verify employment. Sometimes you had other things that you were handling in HR, like employee discipline or payroll. People like to get paid, and when it comes to human resources, and sometimes what I guess I'm trying to say is that we're at the mercy of HR departments many times returning calls so that we can verify if they work there and if the position that they worked is indeed the position that they've stated. So very long answer to answer your question about turnaround times, but probably a criminal one comes back a lot quicker. But if you add employment items and education items in there, maybe just a little bit longer.
Great, thanks.
All right, let's see where I was here. See the importance of post-employment screening. So that's what I was talking about. A lot of times people will run the pre-employment background check, but they often fail to run a post-employment check, or they don't run a very thorough post-employment check. And we're able to provide post-employment sanction screening. And what that does is it ensures your eligibility. And what I'm talking about for eligibility is that, your eligibility requirements for Medicare and Medicaid require that, your people are free from, that work for you are free from sanctions or exclusions that are placed on them. And it also reduces the risk of criminal activity from dishonest employees or even dangerous employees inside your workplace. And so an ongoing sanction screening helps hospitals to be compliant with those federal and state regulations, which helps you to avoid high fines. But probably as important, if not more important, is reputational damage that it causes, keeping your patients from feeling safe, to come to your hospital in the future. And then it also ensures patient safety and accountability. And at the end of the day, builds trust inside of your networks. When it comes to the post-employment sanction and exclusion checks, we're able to do this through a very easy process. And we have multiple ways that we can offer this service. We typically will do this through what's called a batch upload. And the batch upload, we provide you with a template, usually an Excel template, that you provide your employees' names and information. And either A, you can upload that information yourself, or you can provide us with a data feed, and then we can upload that information for you on your behalf. Some of the other post-employment checks are criminal rechecks, sanction exclusion checks, obviously, we're just talking about that. And then we can do large batches of MVR checks as well. If you have a large driving population for your hospital, we can run those in batches as well. These are just some of the sanction and exclusion checks. When we say we're running sanction exclusions, these are kind of the highlight items that we're running, like the HHS, which is the Human Health and Human Services, the OIG, the GSA, OFAC, SAM.gov, and terrorist watch list. But there's many others inside of that list as well. We're running those on every background check at the very onset when we run a background check for you, but we're also able to run these in a synchronized way in any type of cadence, whether you're running them monthly, quarterly, or annually. We can run these sanction exclusion checks for your employee population. Some of the other background checks that we also do are for students and volunteers. We work with a lot of colleges and universities as well as hospitals when it comes to student background checks. And any student that is in a clinical rotation or an internship, or if they're doing some type of a job shadowing, they're going to need a thorough background check done on them as well before they work inside of your hospital. A lot of times the colleges and universities, maybe it's a nursing program for that college or university, they'll run the background checks on the student, and then they'll provide a letter of attestation. I don't know if I said that exactly right, but they'll provide a letter of recommendation based on the student having had a thorough background check, and they'll provide that to the hospital, letting that hospital know that that student has been thoroughly background checked. Some hospitals, though, choose to do those background checks themselves. And so we're able to provide those background checks on the students for the hospital as well. And we can do that in a number of ways. We can either do that as where the hospital pays for those background checks, or we can simply set it up to where the students pay using their credit card as student paid. And then, of course, we don't want to forget volunteers that work inside your hospital. They may be people driving for your hospital, transporting people, or your healthcare facility, to make sure that you're always running background checks on those folks as well. Or they may even be clergy or pastors, those type of things that are working inside your hospital that are not paid by your hospital, but they're volunteering, just making sure that you also properly vetted them as well. I want to take just a moment before I go on to the last thing I want to talk about, which is another service that we offer called Web Verify. But before I do that, I want to provide you with a mini demo of what GroupOne Background Screening online platform looks like. And I also want to invite you that if you would, and I'll provide my phone number and my email address at the end, to write down my email address. And I would love to provide you with like a 30-minute, 40-minute demonstration, very thorough, of the GroupOne system, so you can see how to order, how to place orders, how to review results inside of our system. But I thought I would just take a moment just to show you kind of this is what it would look like. Each person inside of your human resource team that's placing background screening orders will have their own login credentials so that they can log into the system. And once they're in there, we have provided many ways for you to place orders. One of those ways is called an applicant quick invite system, where simply you're able to put the person's first and last name inside the system along with their email. The system then will send them an email invitation to complete a background check. They'll fill out the information that's required, like their name, address, date of birth, etc. And once they've completed that information, the system has an automated way of capturing their signature in the for them to okay doing a background check on them. And once that background check has been done or started, sorry, I had to take a drink there, it will provide the results back to you. And those results look a little bit like this. When they come back, you can see some flashing red flags flashing around, telling you that there's some information that you'll want to pay attention to when you start to look at Johnny Bad's background check. You can probably already tell by his name, might be a giveaway, that he might not be exactly the right person for your hospital. So anyway, that's just kind of a preview look of what the system looks like. I can show you kind of here, maybe if I can grab one that has a report on it. It kind of gives you an idea of kind of what the background screening report itself would look like. It's telling you there's some hits to look at when you get down inside the report, showing you all the addresses where Johnny used to live or work. And then if there's any crimes, which there are, they'll show them and post them down here. Just showing you all the sources that we checked. I'm going very fast through this here because I know we're running up on our time here. That's all the sources that it checked. And then somewhere down here, we probably checked his education and employment and stuff like that. But you can see his records. He's got 35 pages of information. If I was a human resource officer, I would say no to his employment. So anyway, that's just kind of a look at that. I want to pull that back over there and then join our regularly scheduled program over here, where I'd like to talk to you just briefly a little bit about another service that we offer, which is called Web Verify. Web Verify is an employment and salary verification system that's fast, secure, and provides lots of savings to you and FTEs that are working inside of your hospital. It's automated, accurate, in our opinion, amazing. And I think you'll find it amazing too, in that it really is offered to you and your hospital as a value-added free service, and I did say free, to you and your hospital employees. Now, let me talk about what a verification of employment and salary history system does. When your human resource departments get those calls from the mortgage companies or an employer that wants to verify employment on a current or past employee, we are able to automate that entire process so that, provided that you'll have to provide us with a payroll feed, a live feed of whenever your payrolls go, you'll work with our technical staff to ensure that we have a live feed to that information. You will refer those calls from now on over to GroupOne, and they will visit our website. And I want to show you this just for a brief second here as well. They would come into our website. So if you had a mortgage loan company, for example, they would come over here and they would try to verify employment on an employee. You can see that there is a cost to this, but not a cost to you, but a very nominal fee, a very fair price, we think, because some of our competitors are charging over $100 for the same service. They can verify basic employment, which would be job title, dates of employment, how long they worked there, and et cetera. But if they need the salary information, as a mortgage company would, they can also get this information, which would provide 3 years of salary history on that employee. And by the way, by charging this fee to the mortgage companies, and they're very familiar with this, and it's at the cost of doing business, they understand that it's there. It allows us to be able to offer this as a free service to you, your hospital, and not only that, to your employees. And your employees are going to love it because if they ever need to verify their employment, they can go to, for example, CarMax over the weekend when they're buying or purchasing a car, and they're able to provide the loan officer at CarMax with their employment information as well as their salary information. And what they used to have to do is wait till Monday morning to contact Human Resources to get all this information over to the loan company or CarMax or whatever it is. And then they could drive off the lot, say Monday. Now they can do all of that have it at their fingertips 24 hours a day, 7 days a week, and your employees are going to love it. And your human resource department is going to love it as well, because now the time that it took to answer and take all of those calls from the mortgage companies, from other employers, and from social service agencies. And I want to talk about that just for a brief second as well. We offer it free of charge, though, to the social services. So if you have somebody that's on food stamps, Medicaid, or child support, or some kind of temporary housing assistance, we have a way to provide that same information to them that's free of charge. And so I think you're going to love it. Your employees are going to love it, and you're going to love the time that it saves. And also just keep in mind, it is also safeguarded and a safe process as well, because the employees will create a PIN number before anyone can access their information. They're going to have to supply their social security number, also a driver's license number, which is also later used as part of that security that the mortgage lending officer is going to need before they can get that information on those employees. All right, let me take this back over here. And then I'm going to stop talking. Again, my information's up here. David Graves, sales manager here at GroupOne Background Screening. It's been my pleasure today to be able to talk about our company, and hopefully it's been educational and informative to you. And I would love it if you would take down my email address and my phone number, and I would love it if we could schedule maybe a demonstration where I could walk you through the entire process and you can see if it would be a good fit for your hospital. Thank you very much. I think we might have some questions now here.
Yes. One of the questions, it says, Group One's healthcare background is interesting. Do you work in other industries?
Do we work in other industries? Was that the question?
Yes.
Absolutely. For today's presentation, I kind of geared it towards healthcare and hospitals because I believe most of the audience today is in healthcare and hospitals. So I would say that probably 80, if not 90% of our clientele is hospitals. And then that's really due to our relationship with the Dallas-Fort Worth Hospital Council and our longstanding 30 years of working with hospitals and healthcare. However, we have begun to work in many, many other industries as well. Because if you can provide a good background screening report to a hospital and meet those high bars of compliance, you can be guaranteed that the background screening that we provide for your industry, or whatever that industry is, it's going to be of that same caliber and that same high quality.
And then another question is, can Group One provide advice on FCRA compliance?
I didn't quite hear your question. Can you say it one more time?
Yeah, so can Group One provide advice on FCRA compliance?
Yes, we can. We do have a compliance director that works on staff here with Group One, who is very familiar with FCRA compliance. He's also worked at that same hospital. I worked at Parkland Hospital way back when. And part of some of that work that he did was being on the other side of the table, helping with the Joint Commission and some of the others to pass audits and that type of thing. So he's able to pass along his insights when you're going through one of those challenges of an audit. So.
Great. What about David? What about the candidate experience? How do you at Group One support a positive candidate experience throughout the screening process?
Yeah, there's many ways that we do support that positive experience. I would say, and I'll probably pull this back over here into the screen, but some of the ways that we do that is when we started looking at our website and how we were going to operate our website, we wanted to make sure that it was very user friendly. because this is the same landing page that a candidate's going to land on as well. And when they land on that, if they get stuck when they're entering background screening information or that type of thing, we've provided a live chat feature that's at the top right-hand corner here. Whenever it's green, it's available Monday through Friday, 8 to 5 Central. Whenever it's not 8 to 5 Central, it turns into a gray box, but it turns into an email box that's answered the next business day. But we found that that's been very helpful for the candidates, because a lot of times they might get stuck and might not know exactly how to answer a question that we might be asking inside the website. And this way, instead of them having to wait till the next day or whatnot, or just give up completely, and then you lose your candidate. And if you lose your candidate in the background screening process and they go work for somebody else, we've really let you down. So we've really tried hard to make sure that our software is completely user-friendly. The other thing that we also have is we have provided contact information directly. You've probably had the experience whenever you've tried to contact customer service at other companies before and you got menued around. And then when you finally got menued around, they transferred you overseas to someone to answer your phone call that you could hardly understand. We've really strived hard to keep all of that in-house so that when you call, we have somebody who can actually answer the phone. And when we take the call, the person who takes the first call is the person that's going to try to help you. Unless, of course, it's just a question they can't help you with, but they're going to strive hard to provide you with the best customer service when you call in. You mentioned earlier also about not only the candidate experience, but you asked about turnaround times. We've also provided all of this as well, the chat feature, as well as the phone numbers. You'll have a designated account representative if you come to GroupOne who can answer all your questions and be the person that you can call, pick up the phone. We'll even provide you with our cell phone number. So if it's over the weekend and you have a candidate that needs to be hired and working for you, say Monday morning or Tuesday morning in orientation, we're going to make sure that we do everything that we can to get you and your background screening report complete for that person.
Great. Another question, you touched on this a little bit, but what about random drug screening programs, post hire? Can GroupOne support random screening programs?
Absolutely. So we have a lot of clients that will do the random screen programs, also reasonable suspicion programs. So even like post-accident or reasonable suspicion where somebody might be suspected of taking medicine out of the cabinets and that type of thing. And if a nurse is suspected of that, they may be reasonably suspected of taking drugs out of the cabinet. We have a whole program where we can send them either to a lab, and we also have mobile units that can come out on site to test for that as well. So we have various programs to accommodate your needs for both random drugs and post-accident and reasonable suspicion.
Great. I'm gonna put the post out there for one. If anyone has any other questions they'd like to ask, please put them in the Q&A. But I do have one more I was going to ask, and then if there are no other questions, we'll go ahead and close out the meeting. So, David, you mentioned performing criminal rechecks. Are those priced the same as like an initial pre-employment check? Or what if a hospital wanted to do a large batch of criminal rechecks? What would that look like?
Yeah, so we can, and that's a great question. So we can discount those rechecks to make it more affordable for your hospital. And also, if you have a higher volume, we want to make it as affordable as we can so that your hospital can be safe and not be because it costs too much to run a recheck. And we can do that because if you think about it, if somebody's worked for the hospital for, say, 10 years, they haven't been moving around a lot. They've stayed at the same location. So most likely, there's really not a lot of other counties or states to add to the mix, if you will, for the background check. And so typically, yes, we're able to discount that pretty significantly for your hospital when you're running a recheck. And if you're running a large population, say at 10,000 employees, and you're running rechecks on those, we understand that challenge of making sure that that can fit inside your budget. So we do have a way to be able to discount that for you. Great question.
All right. Well, if there aren't any other questions, I'm going to go ahead and close out the presentation. Again, thanks to the GroupOne team for putting on this presentation today. Thank you to everyone else for joining today's presentation. As a reminder, these webinars will continue on a monthly basis, so please keep an eye out for future invitations as we continue to grow this strategic partner program. Also, the recording will be distributed to each association's membership for those who couldn't attend or wish to share this recording internally. Thanks again for your time today, and have a great rest of your week.